Okay, good morning. It's my pleasure to introduce our speaker for today's colloquium. As an experienced healthcare leader for over 20 years with various positions in healthcare administration, she is currently the Director of Operations at New York Presbyterian Westchester Division and a recent ACHE Fellow. I present to you Calandra Grant.
Can everyone hear me? Because we don't have the mic, but I think I can be kind of loud. I'm from South Jamaica, Queens. The South Side, we're a little loud down there. But if at any point you can't hear me, just raise your hand. If I go too fast, just say slow down, because I tend to talk fast when I get excited, and I'm very excited to be here today. I want this to be conversational, so please feel free to stop me, ask questions, say, no, I don't agree with that. Because you're going to have to learn how to do those kinds of things when you really get into the workforce. I want to thank Tony and Sana for inviting me here. I have to give thanks in absentia to Danielle Wiggins, who I believe was class of 2018. She was my intern last year. She was the best intern, and that's not my words, although I would say that as well. She was the best intern that we had at the Westchester Division over the last 5 years. And now she is actually working at our children's hospital at New York Presbyterian. So hopefully she got a lot out of her time with us. So there's just a couple of things I want to talk about today. I was really trying to figure out what did I really want to talk about. What was my goal? So my goal was to take all of you and to hopefully that by the end of this talk, or by the end of our conversation, that at least 95% of you could walk away with something that you didn't know before. Even if it's just one kernel of wisdom. If you can walk away with that, then I feel like I've done my job today. That long 4-hour drive from Westchester would be more than worth it. So I need you to do a couple of things for me. I need you guys to smile. I need you guys to relax. You look amazing, professional. I love it. I saw your curriculum. I love the way that, you know, you're inspired to come and be professional and present yourselves well, but you can smile, you can relax, you can ask questions, you can laugh. It's okay. It's okay, right? Absolutely. I don't want to get you guys in trouble either. Like, oh no. Okay. So just enjoy yourselves, and I really want you to participate and stop me if I'm going down a wrong path. So I was thinking about what I wanted to talk about today. So we're going to talk about becoming an effective leader in a multi-generational work environment, and you'll see what that connection is in a minute. So I just want to take a few moments just to introduce myself, talk about my leadership journey, because it does have a lot to do with learning about leadership. I want to talk about the different generations that you're going to encounter when you get into the workforce. And I want to also talk about becoming an effective leader, and a little bit later on I'll tell you what that connection is and why I want to make that connection. So, okay, that's my high school yearbook picture. I graduated class of '87 from the Bronx High School of Science. I was born in Jamaica, Queens, New York. I live in the same house I grew up in with my husband and my 2 children, 10 and 12, who are very upset that I'm up here right now. I came up in the New York City public school system. All my life I wanted to be a pediatrician. My mother was a nurse, her sister was a nurse. I didn't want to be a nurse. I wanted to be different. That was always how I was. So from a child, I wanted to be a doctor. Because I liked kids, I wanted to be a pediatrician. And I told that story for years and years and years. And I started college at Hofstra University. So Bronx Science is a feeder school for Cornell. So that's my first connection to Cornell. So that's why I'm really excited to be here today, because I didn't come here as an undergrad, but I can always tell people I was at Cornell. Junior year, I was walking across campus, getting ready to register. I was a bio major, chem and psychology minor. Did well in my classes, and it was an epiphany. Halfway across the campus, beautiful fall day, I was getting ready to register for the next semester, and something hit me, and I said, I don't want to be a doctor. I don't want to go to med school. And there was a little sigh of relief. I felt really good about saying that. And then I got scared because it was a Friday and I had to go home that weekend. And I was like, what am I going to tell my parents? And I'm not going to med school. So I went to the registrar's office, picked up the book, took it back, plotted out my next 2 years and the rest of my life. And I said, well, I still love biology, so we'll keep the major. Why don't I teach? I like teaching. I like telling people about cells and, you know, all that kind of good biology stuff. I'll be a high school bio teacher. And so I did that. I came home and I told my father, I said, Daddy, this is what I'm going to do, and I'm still going to graduate on time, blah, 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 blah. And he goes, okay, as long as you have a plan. So that was one of my first life lessons. Always have a plan. And then always have plan B, and always have plan C. And build on those plans. So I went to plan B, and it was wonderful. I took my secondary ed classes. I went and I observed classes and teachers. And by the time I got to senior year in college, I was sitting around with other teachers who had been in the system for a very long time. I learned how to drink black coffee, and I was this close to learning how to smoke, because that's what they were doing every morning, and they were bitter and unhappy and burned out. And I had to deal with disciplinary issues. I couldn't even teach what I wanted to teach because they weren't bringing their books to class. And I was miserable. And I said, like with the pediatrician thing, this is not my calling. And so I graduated in 1991 from Hofstra University with a bachelor's degree in biology, a minor in secondary education in chemistry, and I didn't know what I was going to do. I went back to the place where I had been working over the summer just so I could have some money, and my parents said, you'll figure it out. I talked to a friend who was in a similar situation. She went to Rensselaer Polytech. She was a biomedical engineering major. She was in the same boat I was. And so we said, well, you know, we keep hearing about getting your MBA in health administration. This way you can go into health administration, put your biology to use at some point, and then you can also have the business background. So that's what I did. I said, I'm going to start my MBA program. I said, but I need to get a job in a hospital. So I got a temp position at New York, the old New York hospital, which is affiliated with Cornell. 2 times I get the connection with Cornell. And I was a temp secretary. It was a 3-month position. And I said, that's my foot in the door. About 3rd or 4th day I was there, I was in the copy room. And my boss came in, and I guess I was taking a little too long because there was papers all over the place. And she said, are you okay? And I was like, I'm fine. I'll be in a minute with your stuff. And she said, what is it that you really want to do? And I said, well, I'm getting ready to start my MBA program in health administration. I want to be a health administrator. She said, good, because you're really not good at this copy thing. 3rd time I found out being a secretary wasn't my calling. But that wasn't what I was going to do anyway. What I was going to do was get my foot in the door. So because she asked me that question, that was the most important question that anybody ever asked me. And I asked other people that same question. She was my mentor at New York Hospital for 20 years. And she gave me my first job at New York Presbyterian. And because of that, because she looked past what I was doing and saw my potential, years later I said, Andrea, what made you ask me that day? She said, well, first of all, you were standing there with a whole bunch of papers around you. And you seemed pretty bright, but you just couldn't get that copy thing straight. So she said, I wanted to ask you what you wanted to do. So that taught me a lesson. Look past what people are doing and look at what's inside them. And because she did that, she gave me an opportunity. And because of that, I'm still at that hospital 26 years later. So that's my leadership story. If there's other questions, I came up through the ranks. Earlier this year, as Sana said, I became a fellow. How many of you are members of ACHE? Very good. You all need to join. Get in there while you can get that student membership. And you need to go to Congress next year in March in Chicago. Has anybody been to Congress? Try to go to Congress in March. It's a phenomenal opportunity for networking. So where I am now, I'm at New York Presbyterian, the Westchester Division. So I've been at 3 of the different campuses. We have 7 campuses. And now I'm at our behavioral health facility in White Plains, and I've been there for 3 years as the director of operations. This is a picture of me and Danielle. This was the day that she did her capstone presentation at the end of her internship. I was most proud of her that day, and so I had to throw that slide in. She'll be upset when she finds out that I put it on. Any questions so far? So that's my story, and I'm sticking to it.